Hello everyone, thank you for Baghdad University College of Pharmacy for giving me this opportunity to participate in the 10th International Scientific Conference, Current Challenge and Updates in Pharmacy Education and Research. I'm Zahraa N Fakhreldain, Master's student in Kufa University College of Pharmacy, supervised by Assistant Prof. Dr. Haider Chasib Assar. And our study about prevalence of multidrug-resistant bacteria and its association with patient predictive factor. First of all, antibiotic resistance is potentially disaster problem that mounting globally. The surveillance studies are vital to contain the spread of antimicrobial resistance by creating evidence for local, national, and global management and action. As the incidence of multidrug-resistant bacteria has been studied to lesser extent in Iraq, therefore our study aimed to collect data evaluating the prevalence and antibiotic susceptibility pattern of multidrug-resistant bacteria and exploring the patient predictive factor associated with it. The design of our study was observational cross-sectional study conducted on patients present to microbiological lab in Zahraa Teaching Hospital and Sadr Medical City in Najaf Province, Iraq. And the participants included both inpatient and outpatient of both gender present with different kinds of infection and requested for culture and sensitivity of the organisms isolated from different sources. The total sample size in our study were 475 patients. Out of them, 304 patients were with positive growth medium. The data collected by laboratory tests report that designed to include the result of antibiotic susceptibility pattern from the culture and sensitivity of organisms. Also, our study registered at clinicaltrial.gov and this is the registration number. This figure shows the prevalence of MDR, which is high prevalence of MDR bacteria with the percent of 88. Also, the extensive drug-resistant percent was 23, while the PDR prevalence percent was 2%. In more details, the prevalence of different types of multidrug-resistant bacteria showed in this figure. For example, MRSA prevalence was 73%, while extended spectrum beta-lactamase prevalence was 56%. Bursa with prevalence of 37%, and carabinamase resistance was 25%. And this table shows the association between patient factor and the prevalence of MDR. And as we see, there is no prevalence and there is no association between MDR prevalence and patient factor except for the education level. In conclusion, a very high prevalence of multidrug-resistant bacteria noted in patients with bacterial infection. Also, among all patient characteristics or character, only higher education associated with lower incidence of MDR. And that's it. Thank you for your time.